Sylvia was very interested in the lives of the patients. Her door was always open, and mothers would go in and talk to her. And she would always say, "No, tell me some stories, because I'm going to Washington and I need to make this real. I need to make healthcare real." And it was just wonderful, because she would listen. She would really listen.
You know, it's really about you when you connect with her. She's interested in what's happening with you and how she can support you. And I think that that's what makes people want to support her.
I just remember thinking that she was incredibly vivacious and funny, incredibly articulate and insightful about a lot of the health issues that faced residents of South Los Angeles.
So she's really trying to improve the health of the community in a simple way, but a very profound way.
CHC began a relationship with her when she was the director of THE Clinic, to help everyone clinic, and it's a community clinic here in South Los Angeles that serves uninsured and low-income families. But Sylvia really came to my attention because she was at the same time very active at the national level around issues of HIV/AIDS in minority communities, when that just wasn't something that people were talking about.
My mother was very engaged in community service from, the time we were little. I come from a family of 4 children, so I saw that example.
She is one of these individuals who has a long vision and can see what's on the horizon and can understand where we're headed. So she's moved from this clinical background and to now this fantastic understanding of the relationship of food and access to food and how we prepare food and our health. And so she's on the cutting edge, once again, of an area that I think holds great promise in terms of improving the lives of so many.
To me, what Sylvia's doing is that she's looking at the foods that the community loves. And she's looking at that and saying, let's see how we can make this more healthy.
So I would go to a class with the permission of the teacher, an after-school class, and pass out little containers of plain yogurt. And I would pass out fresh fruits. And I would have them just fix it the way they wanted. If they didn't want blueberries, a lot of them didn't know fresh blueberries, and they were afraid to test those. I said, trade. And then it was theirs. It was no longer my dish, it was their dish. They had seen it, experienced it, conquered it, and they didn't have to go anywhere to do it. And they ate it with such relish. And then I said, would you go home and ask your mother to get you these ingredients? How many would do that? And every hand went up.
I think she's trying to really leave a legacy of health and well-being for the community, and that families stay together and support each other, care about each other, and have power, that women have power to plan their families. I think it's a pretty important legacy.
She is just a remarkable human being who cares very deeply about the people in our community and goes about what she does very quietly, not looking for a lot of thank you and notoriety. She really just does what her heart tells her to do. And she's always right on. She's spot on.
I think there's so much that we can do ourselves. If we have the assistance of policy advocates to say, okay, what's in the way? Let's get this out of the way. What's the next barrier? Get this out of the way. And then the people themselves, from their own interest, will move in the direction of taking better care of themselves. But I like issues that bring us together rather than pit us against one another. And I love the diversity of LA. And I love the fact that we're always exploring one another's richness and the richness of our diverse cultures and learning from one another, but working together for mutual goals. And health is really a pivotal one of those goals.